In the research field, probably the largest gain over the last 40 or 50 years has been in having a much more nuanced understanding of how and why poverty, income poverty, harms children. So we've known for quite a while, and there's a large literature on the fact that children who grow up poor are not doing as well as children who don't grow up poor in nearly every domain of development. So whether we're thinking about their health or about their, how they're doing in school, their learning, or their social, emotional well-being, their mental health, in all of those domains. More recently, we've learned how and why children in poverty are not doing as well as other children. And so we've learned more about the role that families' abilities to make investments in their children's learning, and so to provide opportunities and access to learning materials in the home and outside the home, the ability to attend schools that have adequate learning materials, to have access and opportunities to learning in their neighborhood, at community centers. So those are all things that money, in essence, can buy for families. In addition, we've learned much more about the role of stress that comes along with having too little money, and that's a ubiquitous stress that affects families in the home environment, that affects children in their school environments, that affects them in their neighborhood environments as well. And part of this story is that we've learned that these mechanisms of harm, or these agents of harm in context of poverty, are many, and that children, whether they're in the home or in the neighborhood or out at school, that there are too little resources to support learning and growth and healthy development in general, and there are too many stressful environments and stressful occurrences that are happening for them. And together, we've learned that these are the primary mechanisms or factors that are leading to children who grow up poor not being able to achieve what they could if they weren't growing up in these environments. Pervasive stress that accumulates over time does serious damage to the body and the brain and to children's ability to learn and think, and as well as to their physical health in the long term, that we see the effects lasting into midlife and beyond, and risks for a number of different health problems. And knowing that, and knowing that the stress is operating across children's homes, across their schools and neighborhoods, it's time to begin to try to understand what types of interventions might be able to address that multifactorial ways in which stress is impacting children. Well, how might we begin to buffer children from that stress? There have been some practitioners who've been thinking hard about this for a little while, who've been thinking about, for example, ways that schools can become a hub that connect families and communities, oftentimes communities that are resource-rich but aren't able to connect with families. There are many programs now that are working to connect families and community agencies and to improve schools, all in one comprehensive approach that takes real account of non-academic barriers to learning, these factors that aren't about just instruction, but are about so many of the other factors of harm that children in poverty experience. And so, from a research perspective, it's time to begin doing some good evaluation of that work. I think the other big area of research that needs to be done in the coming years is to ask questions about children's growth in the context of poverty for immigrant children. Immigrant children are at exceptional risk to grow up poor in the U.S., and we also know that the anti-poverty programs often prove to be least effective for immigrant children and the children of immigrants. Undocumented families are unable to take advantage of all of the anti-poverty programs that we do have. Part of it is probably about language and other cultural barriers, but I don't think we really know the answer to that question. So I think that, understanding more about how we can intervene with toxic stress, and understanding, how children in immigrant families are doing who are growing up poor, and what of the research applies to them and what of the research doesn't apply to them.